Yeah, hello, good evening. This is Dr. Chudi Ufundu, and a very beautiful, wonderful evening. And today we're going to talk about our special women who might be having challenges regarding this important aspect of their relationship. So please, this evening we're going to talk to our women, and we're going to talk to all our women that are having problems with sexual drive. Very important topic. Now, if you understand, in our group, we don't have any limits. We go there for all important topics. Now, in our group, the mission of our group, the vision of our group, the mantra of our group is PPP. The first P is what everybody can do, which is praying to God. So when you pray to God every day, you are putting yourself in a better place. Now, the second P is what we're going to talk about today. And the second P is very important because you have to be in a place where you can actually do your own part so that God will do the remaining part. So I can see my admin. Please, when you come in, confirm you can see me by giving me a thumbs up. I can see my admin. Can I thank you and welcome? Once I have an appreciable good number, I'm going to start. So this evening, we're going to quickly look at the things that might be affecting your libido, your ability to desire your partner and actually participate. Very important topic. This topic is very important for so many reasons. If I tell you guys to make love 48 hourly, if your love making is laborious, you're not going to enjoy it. And if you're not enjoying it, it will be more like a pain or a punishment when you go there. Okay, so please, I'm going to allow more people to come in. When you come in, let me know your name, where you're located. This platform is very new. This is my new group in Facebook. It's still the same Snowspirations. So when you come in, you will notice it's SGHS Virtual Admin. And the essence of today's impromptu clinic is to create the awareness so that people can also identify with this particular timeline. It's still the same Dr. Chudi, it's still the same people's doctor. So I will encourage you to come in, settle in, so we can have meaningful conversation about this topic. Okay? So far, only 2 people joined. I don't know if it's maybe the Facebook setup, but give me 1 minute. Let me check something quickly. Just give me 1 minute. Okay. 4 people are coming in. So please, when you come in, I want to know who you are. So tell me your name and where you're located. I love communicating. I love connecting. So I just want you to give me an indication that you're there before I start. I can see my COO. She's already on ground. And I think 3 other people joined. Please make yourself available. Give me a signal to tell me you're there. I need to confirm you are there in real time. We are talking about low libido. Low libido means low interest in sexual activity in women. We're going to talk about women today. Some other time we're going to talk about men. But please, when you come in, let me know who you are. We also have a poll, so I'm going to quickly put up the poll. I want you to make sure you participate in the poll. So just tell me what you feel. Indicate if you're in the category of people that might have this problem. Just indicate, okay? So please take the poll, find the right connection, find the right answer in regards to your own situation, so it will help me to lead you better. There is no room for being shy. There is no room for being ashamed. You just have to come as you are. You are here on a very good note. So if you're having this problem, this is one aspect in so many relationships that women do not come forth to talk about. Some women think it's okay, they spiritualize it, they find reasons to believe it's okay. Now, some other women might actually have good libido, and they might think that something is wrong with them. I've actually had a couple of women that will come to me and they'll be telling me, Doc, I think I'm having problems. You know, my husband is complaining. I demand sex all the time. It's actually what you should do. The moment you no longer feel like you need to have sex with your partner, your relationship is having problems. So there is nothing to be shy about. Just come as you are and please introduce yourself. Let me take a head count. So take the poll. I need to know your particular situation. So please take time and take the poll, okay? We're going to quickly talk about the factors that might likely lead to your low libido. And we're going to look at the remedies. So there are, Zara, there are likely things that might affect this. So please make yourself comfortable and let's get started. And I also have a question I'm going to put on the screen. Okay? So just find where you belong to, ask your questions, and I'm going to start. So once you come in, make yourself comfortable, and we are going to start very, very soon, okay? Hold on. Okay. I was wondering what happened to my screen. Okay, so let's talk about the likely factors that might be leading to this problem actually. Now, it's not unusual to experience this. So many women are going to discover that as they're getting older, their libido is actually dropping. It's expected. And for the simple reason that so many things happen in life. So as you're getting older, your hormones are changing. One important hormone you have to think about is estrogen. So as you're getting older, your estrogen level is dropping. So it's not unusual to lose interest in making love. You're just there, and it's also possible you're struggling with a lot of things. Maybe you're looking for a baby, you don't have a baby yet. Maybe you're not too comfortable in regards to your lifestyle. Maybe you're not happy in your relationship. So it's not unusual to notice that your libido is lacking or reducing or completely not there as you're getting older. Age-related libido is not necessarily a problem. It begins to become a problem if it's affecting your relationship. It can be very frustrating if you and your partner are having a mismatch. So some people can find a situation where their husbands are very, very high in their libido and they are very, very low. So anytime your partner wants to be intimate with you, you begin to complain, you begin to look for reasons. This is a very bad place to be because it might give your partners an opportunity to go and cheat and bring a couple of diseases on. So you need to talk about this. So once you notice a mismatch, both of you will not be 50-50. Some days your partner might be 90, you might be 10, but you need to meet your partner in the midpoint, okay? Now, naturally, there are a couple of factors that will affect your libido in regards to reducing it. When you become pregnant, so many pregnant women, once they become pregnant, their libido will drop by default. Now, in some other women, when they become pregnant, they notice that their libido can go up. So it's individualized. Now, also during breastfeeding, because of hormonal changes, because of some stressors in your life, your libido can also drop. So pregnancy, libido, and menopause. These are three important transitions in the life of a woman. They are not disease condition. Pregnancy is not a disease condition. Breastfeeding is not a disease condition. Menopause is not a disease condition. If you're going through any of this, it might likely lead to your low libido. But there are a couple of things you can do by yourself to help yourself. Now, some people can also be going through a lot of stress. One of the biggest enemies in sexual relationship is stress. If you are stressed, your sleep is going to be affected. Your happiness is going to be affected. You might likely be moody. You might even be depressed. You might even be having anxiety. When you have any of this, you will not be in a better position to initiate sex. You will not be in a better position to practice PPP. Remember that in our group, PPP is supposed to be practiced what? 48 hourly, the second P. So think about that. If you have to make love every 2 days and you don't have that zeal, you know, there are some days you will feel that you don't want to make love, and that day might be the day you might be lucky. Now, some people might also have some illnesses. It might be diabetes, it might be hypertension, or a couple of other things. Now, some people can also be on some medications. There are some medications that can drastically reduce your libido. So you don't need to go on any medication if your doctor didn't give you those medications. Now, some people definitely might have relationship problems. If you're not in a good place with your partner, sex will be the last thing in your mind, right? You might even start desiring your previous relationship. Now, let me just say this, because we're adults. It's not unusual to come to a point in your relationship, in your marriage, that you begin to think you made a mistake, that you begin to want to go back to the previous relationship you felt was good. So when you begin to think about your previous boyfriend or girlfriend, it doesn't mean you've gone crazy. You are not a demon. You're not a bad person. You're just a normal person. But the question is, when you get to that boulevard of thinking about doing things you moved up from in the past, what will be your decision? It's okay to see people and desire them, but the action is what is the tiebreaker. So if you are having relationship problems, definitely it's going to show in your sexual activity. If you're not in a good place with your partner, if you guys want, you can lay in the bed and every single thing that attracted into to you previously will not make meaning. Now the question is, what can we do about this low libido? First of all, we have to start with our lifestyle. There is no need being in a hurry to go, oh, don't give me this. What can I use to boost this? What can I use to boost that? We have to start from our lifestyle. The very first lifestyle that can help you in your libido as a woman is what? Exercise. Exercise is huge. When you engage in regular aerobic exercise like walking, swimming, running, jogging, it's going to help you to increase your stamina. It's going to help you to improve your body image. So many women have lost their interest in sexual relationship because they felt, oh, I'm big. And if you have a very bad relationship, if you have a very bad partner, your partner might even be making you feel like you don't matter. Previously, you were the finest person and your partner proposed to you and you guys are living together. Suddenly, you begin to query yourself. You look yourself up in the mirror. You can't recognize the woman in the mirror because you're feeling that you're no longer worthy. But when you exercise and you release the endorphins, endorphins are feel-good hormones. When you release your endorphins, endorphins will make you feel so good. And endorphins are released when you're sweating. So when you exercise and you sweat, you're increasing your fitness, you're increasing your stamina, you're increasing the level of your body image, and you're increasing your mood. When you increase your mood, you will boost your libido. When you're not in a good place, the last thing on your mind will be what? Sex. So exercise is very important. Now, food. There are so many food items that can kickstart your libido. But there are also some food items that will kill your libido. If you form the habit of swallowing fufu, amala, and gari all the time, morning, night, afternoon, definitely when you do all that, it's going to be in your body. You're going to be so heavy that you can't even step out and perform your civic duties. So when you eat a lot of fruits and vegetables, when you drink a lot of water, when you're mindful of what you put into your body, sometimes you can give yourself some chocolate, some ice cream here and there. They can help to boost your mood, but don't go overboard with them. So food is very important. Embrace your vegetables and your fruits. It helps with your libido. Now, stress. I've already mentioned stress. Avoid stress. There are some stressors you can't help. If you're living in Lagos, you have to deal with the traffic. You have to go and look for money. You have to do what you need to do. If you have kids already, it's going to affect your relationship. So deal with the stressors that are naturally there. Don't create storm in a teacup. Things that don't matter, don't worry about them. Now, the next thing, communicate. This is an area that so many women are very, very poor. They expect their partners to know how they feel. You don't communicate with your partner. You're carrying a long face. You're not telling your partner what's going on. You're not telling your partner what's bothering you. When you don't communicate, you are killing your relationship. And it doesn't make sense. Both of you are friends to start with. So anybody you have a good relationship with, up to the point of making love, you are friends. Friends talk to each other. So communicate with your partner. Let your partner understand what your problems are, what your challenges are, how you are feeling, how you're feeling about infertility, what you guys need to do. Tell your partner how you want to be made love to. Tell your partner what you like. Tell your partner what you don't like. Both of you are adults. When you assume that your partner will know this or know that, you are making a mistake. Nobody can enter anybody's mind to know how that person feels. So communication is key. Matter of fact, the most important factor to take home today is what? Communication. So if you notice that your sexual relationship has dropped, communicate about it. Talk about it. I know some people are very timid. I know some people are not really good in, they have naivety. But talk about it. Come on, this is the person you're going to spend your life with. Look your partner eyeball to eyeball. Tell your partner, maybe during dinner, this is how I'm feeling. What can we do about it? Now, this takes us to the next tip. Set aside time for intimacy. If you have to have a timetable, have a timetable. By default, you already have a timetable. So every 2 days, you have to make love, right? If you're looking for a baby. So set aside time for intimacy. Go on vacation. Travel somewhere. Do something different from what you normally do. The problem is, when you wake up, the man is going this direction, the woman is going this direction. If you have kids, you're looking after the kids, the man is pursuing money. Then you discover that you guys don't set aside time for intimacy. So set aside time. You can make it weekendly thing. It can be Friday, Saturday, Sunday, exactly for both of us. Set aside our time. If you have to travel, travel. Rediscover yourselves. Tell yourself exactly why you guys came together. You have to do this. Now, spice up your sexual life. We have overtly spiritualized sex. We have demonized sex. We have made it look like it's a sin. But guess what? Without this, you won't be here. There is absolutely no sin in your partner for life, in exploring things that you guys don't even know how it's going to affect your relationship. So spice up. Get sex education. Get some tips. Get some help. Talk to therapists. Communicate. If you're having this issue, talk to your doctor. You can get a subscription in this group. You can discuss with me and I can help you. There is absolutely no way you can die in silence, because the biggest problem in relationship is this. Now think about your habits. And I'm going to list a couple of things you can drop, and believe me, it's going to help your sexual life. No soda. Soda and alcohol are the same thing. Some people condemn alcohol, then they binge on soda. They are the same thing. They are all not good for you. So condemn your soda. Condemn your alcohol. You can be someone that might just drink sparingly. Maybe during function, you can take one or few things. But don't make this your comfort zone. Some people are not happy. They only go to alcohol to make themselves feel happy. Lately, so many women are binging on alcohol. So no soda, no alcohol, no drugs. Now, I know in Nigeria, there are so many concussions. You guys believe that, we do this and do that. So many of them out there. Tiger this, tiger that, and all those stuff. Be careful. My sister, my brother, be careful. Sometimes, if it looks larger than life, it's larger than life. So drink your water, sleep, keep positive friends. This particular one is very important. Very, very important. You over time become the people you hang around with. If you hang around with negative people, you're going to be negative. So hang around with people that will uplift your mood. Hang around people that will encourage you. Hang around people that will give you good values. Hang around people that will give you good opportunities to express yourself. Good advice. Be mindful of the group you belong to. Like if you belong to our community is a community of love, because there is absolutely nothing we can discuss with you here. So walk with people that love you. Vibe with your tribe. Tribe with your vibe. If people you have around you are full of negative things, they will kill your sexual relationship. Believe me. There are some people you will tell about your problems, they put it in social media. There are some people you tell about your problems, they begin to blame you. So they are always looking for faults. Avoid those people. You don't need them. There are some people you might call on the phone. Oh, I can't sleep. It's 1 a.m. They begin to list litany of the reasons why you're not sleeping and what you did and what you didn't do. Those people are not your people. Be very, very bold to remove people that will cause you problems. Your social circle must be solid. I so much believe in few quality people. Only quality people. Only quality people. OQP. Admin, capture that for me. Only quality people. Believe me, your friends can affect your relationship. Your friends can affect your libido. Your friends can be a factor in your infertility. There are some friends you will go to. You tell them about the secrets in your home. They will put fire in an already burning inferno. There are some friends you go confiding. You keep telling them about your partner, and they keep painting your partner as if your partner is a demon. No matter what your partner does, deal with it together with yourselves. The moment you begin to involve third parties, some of them might not be happy with you. Some of them might feel good that you're having the problems you're having. There are some people you might have now, they will be happy that you don't have a baby because they want to get back to you. This is human beings we are talking about. But don't give them that opportunity to do that. If you have but one friend, you're blessed, especially in social media. If you have to deactivate your social media, if you have to leave Facebook for some time, if anything that can help you, just do it. But people are really, really mean. Believe me, people are very mean. Now be careful. Sometimes you go to spiritual leaders, you go to your pastors, and they will flip the table on you. They will blame you. They will dig into so many things and make you feel like you're stupid. Anybody trying to make you feel bad when you're reaching out for solution, that person doesn't love you. So be careful. There is absolutely nothing wrong in what you're going through. You are going through what any other person is going through. Okay? So I'm done with my presentation. I'm going to sit back, and in the next 10 minutes, I'll provide us feedbacks. It's a poorly attended clinic, but that's okay. We'll normally show up here once in a while, but you have the floor. This is a very big advantage. You have the floor to ask me any question whatsoever, and I'll give you a feedback in real time. So the clinic is open now. Okay? Correct. Vibe with your tribe. Vibe with your tribe. Your tribe will determine your vibe, and your vibe will determine your tribe. If you understand this, my sister, nothing can stop you. And remember, the more you engage in this lovemaking, the more you're increasing your potentials of becoming pregnant, especially if you're above 35. Yes, only quality people, OQP, only quality people. So don't look at the number of friends you have in Facebook. I can tell you categorically that out of those 5,000 friends you have, 4,000 and plus of them don't give a damn about you. I can tell you that categorically. I'm telling you the truth. There are some friends you have, they've never liked anything about you. They've never said happy birthday. They've never said anything. They see you smiling. They begin to think that the world is okay with you. What are friends for? If people can't communicate, why are you adding people you don't know? Why are you adding people that you always fight with? What are they doing in your timeline? So be careful. Can a 47 I believe you want to say age, right? So at 47, can you use your ex? So the question is, what's the standard? What's your baseline? So at 47, the first thing we have to do is to do what we call ovarian reserve test. You can only use what you have. Now the problem is, as you get to 35, you begin to lose both the quantity and quality of your eggs. But if we check your ovarian reserve and you still have eggs, yes, you can become pregnant, both naturally and with assisted reproductive technique. So there is no other way to tell you yes, you can or you can't. What you need to do is to be realistic. You are 47. Two things. It's possible you've gone into menopause, or you're warming up to go into menopause, or you haven't gotten there. Okay? So three things. So that you need to tell yourself the reality that you're 47. So anything that is not meaningful, any solution that will not yield result, don't go there. You cannot afford to spend your 2022 going to a place that will tell you, oh, I went there, go and try it. There is no room for trying. You have to be laser focused. You have to understand that you're 47. Then you go for things that will work. And if you allow me to advise you at 47, I will tell you to go for your assisted reproductive technique without wasting time. At 47. Because your chances are dwindling. At 47, possibility you've gone into menopause is very high. Possibility your fertility is completely gone is high. And especially if you've been having infertility for a long time, so if you're not able to have a baby 10 years ago and you're 47, my sister, probability is that that problem will still be there. So you need help, okay? All right, let's continue, guys. So Love Boo, go and get help. Admin can set you up. If you want to talk to me, my admin can set you up and you can get a subscription. You can come in for 1 week. You can come in for 1 month. You can come in for 3 months. You can come in for 6 months. If you are already pregnant, you can come for our Telegram group consults. Very important. The reason why I'm showing up this late is to help some women. Some women are not sleeping tonight because they're feeling so bad. When you have cried, when you have had sleepless night, when you wake up in the morning, what are you going to do? What is your action point? Or are you still going to be planning? There is no room for excessive planning in 2022. 2022 is the execution year. Okay? So guys, okay, we have chatted before. The problem is, if we have chatted before, have you followed my instruction? If we actually chatted in my inbox, you had a luck because I don't normally chat with anybody in my inbox. So if we chatted before, I believe I've given you the solution to your problems. Okay. All right. Please begin to ask your questions. Questions, please. Questions, please. Admin has done a great job. Remember the motto of our group. Remember the vision of our group. Remember the mission of our group. Simply PPP. pray, play, practice. Play, pray, practice. The first one you already know. Play means at least 48 hourly. That means today being Thursday, tomorrow you can have a break. Saturday you resume. Practice means every single thing I've been teaching you. Make sure you imbibe it. Make sure you attend my daily broadcast. Make sure you attend my monthly masterclass. By the grace of God, from tomorrow, we'll start giving you details about our masterclass. Make sure you subscribe. Make sure you see the doctor I refer you to. If you can do all this, you're warming up to be a mother in 2022. Nothing can stop you. But right now, please start asking your questions. Start asking your questions. 2022 is the year of execution. We have been planning. Some people have been planning for 10 years. Some people have been planning for 20 years. When are you going to execute? You cannot keep planning. If you need something, go for it. The reason why our mothers had us today is because they wanted to have us. If our mothers didn't want to have us, they would have aborted us. They wouldn't say yes to our parents, but they said yes to our parents, and they made themselves available to become mothers. So mothers can go anywhere, the right place to become mothers. So if you're sitting in your comfort zone, and if you're still planning, like the woman at 47, if you are not careful, by the time you get to 48, it's all over. That's a fact. And an average Nigerian will find it difficult to use a donor egg. So what will you do when you've used all your eggs? If you are desiring to be a mother by default, which is what I wish for you, but if you discover you no longer have eggs, but you still want to be a mother, what are you going to do? The same thing is applicable to the men, because so many men will think that the problem is with the women, but the problem might be from them. As a man, as a proud man, assuming you're Igbo like me, as a proud Igbo man, if they tell you that your sperm is gone till November, what are you going to do? With all your money, with all your cars, with all your fame, who will continue your lineage? Who will continue, assuming you have siblings, brothers, sisters, and they all have their kids, but you don't have your own yet, and you're an Igbo man? What are you going to do? Are you going to put your case in the village square? Are you going to open your mouth and you tell the whole world your problems? No. You do what a man would do. You keep your family secret and you go and do what you need to do. And there are so many ways you can become a father. You can go through natural means. You can go through IUI. You can go through IVF. You can go through donor sperm. You can go through donor eggs. You can go through surrogates. And you can adopt. And nobody has the right to query you. Because when it's all said and done, who will continue your family name? If your father gave up, we won't be here. Like in my own situation, my dad is dead and gone since 1999. But I'm representing my dad in this world. So I'm challenging you today as a man, as the leader of that family. What plans do you have for 2022? Are you going to be blaming your woman? Some of you just came back from Christmas. Your mother, some mothers are very evil. Some mothers are actually the problems in their kiddies' relationship. Some of your mothers lined up young girls in the villages. Some of the husbands encourage their wives not to travel to the village for some reason. So they, I have a meeting. I don't have money to travel with you. Then they go to the village. Their parents, their mother especially, and their aunties. There are some aunties that are nasty aunties. They've lined up young girls. So the whole of your Christmas, you were testing young girls. So you're counting by February, you start looking for the young girls you impregnated in the village. But guess what? It's possible you have oligospermia. It's possible you have azoospermia. You can't give what you don't have. So if you're leaving your woman to go and look for another woman when the problem is coming from you, you're wasting your time. A real man will stand with the woman when things are going wrong. That's the vow you took. That's your for worse. Things are not always going to be for better. So I'm challenging you as a man. Be a good leader. Some of you have had your family budgets now. You come to Facebook, anywhere gossip is, trending, you go there, you're the first. You're the first to receive gossip. You're the first to argue. You're the first to fight. Now, when it's something to do with your health, attend seminar, no problem. attend, subscribe, no problem. You give crumbs to the most important thing about you. The most important thing that will make you happy in 2022 is your family. But you are allocating crumbs to it. It doesn't make sense. Like my admin said, IVF, IUI, surrogacy, adoption, donor egg, donor sperm, natural conception, they are all wonderful routes of becoming a parent. Nobody can query you. The only three people that should know about your struggle in life, you, your partner, and your doctor. Don't tell your mom. Don't tell your pastor. I said it. There are some good pastors. I'm finding it difficult to know the good pastors now because there are so many of them that are after your money. But when you tell your doctor, a real doctor, in confidence, your doctor will keep your secret. You tell your mom loves you, but she might love you the wrong way. You will tell her a secret and she will go and broadcast it in the family meeting. Because your mom has her own agenda. Most mothers just want their grandkids. So they don't care how you bring those grandkids. Just give me grandkids. They will even use your sister to attack you. Look at your sister. Look at your younger sister. Look at your cousin. Look at this. Look at that. They will make you feel like you don't matter. But life is not all about having kids. Your happiness is also important. Now, there are so many women that might not be able to marry or do whatever. Whatever you want to become. If you want to be a mother, be a mother. I'm not going to be the person to tell you, oh, you're single. Are you going to do this? Are you going to do that? You know yourself. Prioritize your happiness. Do not spend your life, the last days of your life, miserable. You can die a miserable Christian. You can die a miserable born again. But I'm telling you today, if you know that babies will bring good fortunes, of which they bring good fortunes, for every singular baby you're going to have, God has a purpose for them. Today, I posted a baby they abandoned in a car. In this era of ritualists and stuff, they abandoned the baby in a car. And a very good driver saw that baby and took the baby to a radio station. So imagine that. This is the world we are living in now. So be careful, okay? Let's see if we have other questions. Okay. How do you know exactly when you ovulate? When your cycle fluctuates between 21 to 27 days. Now, I'm going to use this to teach, then we wrap up. Now, what you need to focus on, I think one of my classes, I asked you guys to bring a white paper, right? Now, I'm going to give you an assignment. Sophia, I'm going to give you an assignment. Go and get a plain paper. A plain paper, okay? Write January to December. Put it in front of a big mirror in your bathroom, okay? Put that plain paper there. From January to December. Now, for this January, if you have already bled in this January, go to that your calendar. Mark the first day you bled in red. Now, you start counting from that first day you bled. Once you get to up to 2 days of bleeding, I'm okay. If you get up to 7 days, I'm okay. Now, you mark when you started and when it stopped for January. So let's give an example. You started bleeding on the 2nd of January. You stop bleeding on the 9th of January. 2nd and 9th is the only thing I want to see in your calendar for January, okay? Now you go to your February. You mark the same thing. If you bled on the 2nd of February and you stop bleeding on the 9th of February, you mark it. Now when you calculate your cycle from January to February, you are looking at from 2nd of January to 2nd of February. So the interval between your two bleeding days is your cycle. And the regular cycle is 21 to 35 days. It's not constant. It fluctuates. So if you count the number of days between January when you bled and the number of days between February when you bled, assuming you have in your own case 21 days, you are on the lower limit of normal. So it's normal, but it's lower. Now you do the same thing for March. You calculate from February 2nd to March. Assuming it repeats itself by March 2nd, then you have a regular cycle. So long as you're bleeding for 2 days, up to 2 days, and up to 7 days, it's normal. So long as your cycle is fluctuating between 21 to 37 days, it's normal. Now, when you have this constant, you now bring in factor 14. Admin will post that. You bring in what? Factor 14. When you bring in factor 14, assuming your cycle is 30 days, when you minus 14 from 30, you're going to have what? 16. So 16th day will be the likely day you will ovulate. And your first day of your cycle is when you bleed. So in your own case, 21 to 27 days, it's somewhat irregular because your fluctuation is from the extreme to the other end. If you were fluctuating from 21, 23, 24, we can find the average. If you're fluctuating from 27, 28, 29, we can find the average, but you are kind of skewed differently. So you might likely need to see a fertility specialist. But this is what we do in this group. Whether you know how to calculate or you don't know how to calculate, we don't care. The only thing we care about is that you're making love. So don't go calculating. You can be Chico Obi, you can be Albert Einstein, you can be the best mathematician in calculating your ovulation. It doesn't really matter in our group because we don't believe in timed sex. We believe in you just making love when you're not bleeding. Even when you're bleeding, if you want to make love, you make love. That's what we believe. That's what matters. Can ectopic surgery delay fertility? When you have ectopic pregnancy and we remove the tube, it's called salpingectomy. Unfortunately, that side of the tube is going to be damaged. If you are so unfortunate that the other side is also damaged, the only opportunity you will have to become a mother is IVF. So once you have ectopic pregnancy, that ectopic pregnancy has damaged that tube. So that tube can no longer participate in pregnancy process. If you are lucky and the other tube is open, you can still be a mother with one open tube. Okay? So yes, the answer is yes. Amazing. Admin has already shared the article for calculating your ovulation and your fertility window. Okay, guys, my time is up. So thank you, and I hope you participated in the poll. Okay, only 3 votes. So only 3 people answered for the poll. That's okay. Let me see. Hold on. Okay. All right. Okay, so guys, thank you for coming. If you still want to participate in the poll, take the poll. If you have low sex drive, just tell us yes. If you don't, give us a no, then we can move from there. But please stop ovulation sex, stop timed sex, stop fertility window sex. We recommend 48 hours lovemaking, which is equivalent to every other day. This is what will work for you in 2022. Make love frequently. The reason why you have to make love frequently is because at any point in time, you have sperm in the vagina. It can survive up to 5 days. So assuming your egg is playing gymnastics, your egg is trying to confuse you, you are battle ready. The egg can be released by 1 a.m. The egg can be released by 12 a.m. If you are waiting for your partner to come and make love to you within that time, the egg will be released. Your partner might be snoring. But when your partner is constantly making love to you, depositing quality sperm in the vagina, they will be ready. So that even if the egg is trying to play tricks, the sperm will arrest the egg. This is why we encourage regular love making. It's not because I want you to be making love all the time. It's because you want to be a mother. So when your partner is depositing a lot of sperm in the vagina, that sperm can survive up to 5 days. So your partner can make love to you on Monday and get you pregnant by Friday. That's a fact, especially if you're above 35. So that's the reason why. I know after today, some people will still subscribe and tell me, don't calculate for me, I'm doing this, I'm doing that. Stop creating problems where there are no problems. We don't have that liberty of time. Okay? All right. Do we have any other questions? Please, if you have any other question, please ask. If you want to have a baby in 2022, commit yourself to doing the right things. Go and plan for the master class. By tomorrow, by the grace of God, we'll announce the topic. See your fertility specialist. Live healthy. Be positive. Make love with your partner. You will become. If you want to have more babies, then please do the right things. If you don't have a baby already, come on. You're missing a lot. You guys saw me shouting at Zara and Bumeja. That's what your kids will do to you. But that's why we're all here. There is a reason why God made you a woman. Okay? So if you need to consult with me, follow my admin. I will seriously and definitely encourage you to do that. I can help you walk the walk. If you're not in Nigeria, but where you're living is extremely expensive to go for your treatment, we can refer you to Nigeria. If you're a Nigerian, you can go back home. We also have the best out there, and thankfully they are cheaper. If you're thinking of doing IVF, stop thinking. If you're planning capture this. If you're planning to do IVF, stop planning. If you're considering, stop considering. What are you supposed to do? Do it. Call that doctor, make that deposit, start going. Just do it, my sister. There is no room for planning in 2022. There is no room for considering. We only have one option. Either you become or you go home. Become a mother or you go home. Unfortunately, some people will only have this year to become a mother. That's the way God made it. I don't care if you met your Romeo today and you're 50. If you and your Romeo are 50 do the right things, you can be a mother of 2. You can be a mother of 3. You can be a mother of 4. I told you guys a story, a testimony. A lady that was delaying her IVF for a long time. The first IVF triplets. For any month you're bleeding, if you are releasing your eggs, you're losing your family. Do you understand that? For any month you have ovulatory bleeding, you are losing your eggs. For any egg you release during your ovulation, if the sperm does not fertilize it, you are losing your family. And you're not in the same category with men. Men have millions of sperm. You only have fewer eggs. Every woman is given at least 400 eggs. And of course, you can't have 400 kids. So from the very first point you started bleeding, you have been losing your eggs every month. That's why it gets depleted. That's why you go into menopause. Understand this so you will understand your own situation. This is your reality. Unfortunately, so many women are living in denial. So many women will come, Doc, help me, help me. One woman was telling me, Doc, you're my daddy, help me, do this, do that. But my sister, I can only tell you the right things to do. I cannot come and manufacture a new egg for you if you have gone into menopause. If you are 38 and they told you you need donor eggs, go for it. Unfortunately, if you've gone into low egg reserve at 38, you have premature ovarian failure. So go for it. Please. I want to announce your baby on this podium now. There is nothing wrong with you. You can also be celebrated. Your congratulation is waiting for you. There is nothing wrong with you, my sister. Take a good look at yourself in the mirror. Now, don't tell me what God does not do, does not exist. I'm a child of God. I believe in God. But stop laying it on the God's shoulders. Go and do your own part. God is waiting for you. Stop blaming God if you're not doing the right things. Prayer is not the problem. Stop going from one prayer meeting, olive oil. You are the master of different olive oils. You prayed from Genesis to Revelation. What? Are you kidding me? Do you think our God is deaf? Our God is not a deaf God. Our God is hearing you. You are the problem. Move today. Share this video with anybody that needs help. We are here to help you. You can have your 1, you can have your 2, you can have your boy, you can have your girls. You can actually have 4 babies in 2023. Do you understand that? Especially if you are above 35. By default, you have a better chance of having multiple pregnancy if you are above 35. Both naturally and through IVF. Because as you're getting older, in as much as you have fewer eggs, they can easily divide. That's the beauty of God. So you can have 15 years of infertility, 10 years of infertility. Now when God opens your chapter, God will say, I have remembered you. For all the troubles you have, I'm going to give you double. This is the kind of God we worship. This is the practical God we are worshiping. And God doesn't come down in person. God walks through people. God is putting the messages I'm telling you now into my mouth. I know somebody is listening to me. So the decision of what you want to do in January 2022 is up to you. You can't come this way again. You can never have 13th of January again in your life. It's gone, it's gone. Go and get this right, my people. Okay, I'm done. So thank you for coming. If you need help, follow my admin. Decide today who you will follow. For me and my household and this family will continue to believe God, will continue to trust God. No matter what they call you, it doesn't matter. It's what you call yourself that matters. Some of you, your husbands are abusing. They are calling you names. Look at you, barren. How can a sane man, curse the wife? How can you curse your generation? Are you crazy? Do you understand? In your moment of madness, you begin to rain abuses on the woman you said you're going to spend your life with. Is that not being crazy? It doesn't make sense. Be careful. And you can't be in this group, you have all the knowledge and you're still in the same spot. There are some women I will just be talking, no, doc, I will talk to my husband. My husband, one of them was telling me this evening, doc, my husband is not happy that I did this and he failed. In fact, he was not happy. I'm like, I can give you your money back and I won't consult you again. Stop telling me all this nonsense about your husband. You didn't cause all these problems. People have problems. Stop allowing people blame you for everything. Stop allowing yourself, be used as a footmat. You're a daughter of somebody. God bless you guys, and I'll see you guys tomorrow. Tomorrow is my 40th Fridays. Remember, 12 p.m. Eastern Time, 6 p.m. Nigerian Time. You will see me. We'll be talking about the things we love talking about. I'm going to go live from this channel, but we're going to go live on our page. For today, I went live in my timeline, in the new timeline. God bless you guys. Take your action. Follow up with my admin. Tell admin what you need. The reason why we have different categories is because to allow everybody to come in. I know it's not everybody that will afford 20,000, 10,000, 5,000, but you can afford 2,000. Can you not? If they have given you money this Christmas, don't buy that Gucci bag. Don't buy that shoe. Don't go and hang out and do ashebi with women that will curse you and gossip with you at your back. Don't use that money for that purpose. Invest that money wisely. Invest in your family. God bless you, and I'll see you guys tomorrow. Admin, thank you so much. Can we all appreciate this amazing admin? You see, it's only few people that can actually, genuinely love you when they don't know you. And this is my relationship with you guys since 2015. I don't know 99% of you, but I have formed a love relationship with you. And this is the same love relationship that my COO has formed with you guys. We love you guys. We are always there for you guys. So can we all applaud Kene for showing up despite all her tight schedule, family, work, and everything. Kene, thank you so much. I'll see you guys tomorrow. Until I see you, remember, 2022 is the year of execution, not the year of planning. Can you repeat after me before we go? If you're believing God for a baby, before we go now, listen to me carefully. Whatever I'm telling you comes. Whatever I'm telling you is coming. I don't know where it's coming. Look, I'm keeping it real. I'm someone that keep it real. Can you put on this screen right now that 2022 is the year of execution? Can you put on the screen right now that it's no longer planning, that you're done with planning? Can you put under this testament and you say that 2022 is the year of execution before we go, and when you're done, you tell your partner we said so? Can you do that quickly? Every single one of you. It shall be well with you. Okay? Send us a message. Let's move into our glory. This is the year that God has been planning for us. This is the moment you've been waiting for. This is it. This is the time you've been waiting for to blow your mind away. You will remember I said this on the 13th of January 2023. You will look back and you say, I didn't know this guy is a prophet. I'm telling you today that babies will cry in your home. I'm telling you today that you will call me by 1 a.m. and you tell me, Dr. Chudi, these kids cannot allow me sleep. This is your portion in 2022. Nobody has the right to make you cry again. Nobody. Nobody made you. God made you in his own image. You're the daughter of God. Nobody can stop you from becoming a mother except yourself. Stop sitting on the fence. Stop doing the wrong things and expecting the right things. If you need help, come through the front door. Don't come through the back door. Don't send me messages in the wrong places. Some people send me message in 2015 and they see me every day and they think I'm a monster and they think I'm a beast. But I have millions of messages that I haven't read. So when you send me messages and I don't reply, it doesn't mean I don't love you. It means you are not loving yourself. If you need help, come through the front door. Let's fellowship while we can. God bless you, and God bless you, and God bless you. It's not every time I'm driven in this direction to keep repeating myself. But I don't know, someone is going to jump in 2022. I don't know you, but someone, it's going to jump. Someone will take the last kobo, the last energy. Someone will even borrow and go for IVF. And lo and behold, they will see 3 sacks on the day of your ultrasound. Someone is going to write that testimony in this group. I remember a lady that came to my inbox in 2018 and she told me, Doc, you know what? I'm 45, but guess what? I'm done. You see, that testimony of triplets is going to be my portion. And guess what? In 2029, this lady had triplets. So when you show up and you claim people's blessing, are you claiming their actions too? Are you condemning the only option left for you? Are you condemning your binding and casting IVF? Meanwhile, IVF is your only option. You better move when you can. You're a mother. Your breast is for your baby. Your womb is for your baby. Your bosom is for your baby. When your babies are crying, they're looking for you. Your tears are not for just wastage. Your tears is a tears of joy in 2022. Admin, capture that for me. The tears you're gonna cry in 2022 will be the tears of joy. Congratulations is gonna come knock on your door in 2022, and nobody can do nothing about it. Nobody. So you better wake up. You've cried enough. They bullied you enough. They've called you so many names. Enough is enough. This is it. Go and think about all these things I'm telling you. Enjoy the rest of your evening. Remember, go and write this boldly. 2022 is the year of execution. 2022 is the year of execution. 2022, babies are gonna cry in my home. 2022, I'm gonna stay up, I'm gonna breastfeed my babies. I'm gonna have a joyful, sleepless night like other women. God bless you guys, and bye-bye for now.